we'll try and organize like a surprise prize for the person who gets the highest score at the end. Okay, so I think we'll start. We'll give it another maybe 20 seconds, and then we'll kickstart everything. So if you have anonymized yourself, you might have to de-anonymize yourself at the end. Okay, time to start, okay? So just the first one. Can everyone see this? Time for the first question.
Yeah.
Basic one. What does the thalamus mean in Greek? Nice, nice, nice. You guys knew your stuff. So specifically, some people say it means bridal chamber, because I guess it's quite an intimate central region. We'll cover that in a second, why that's important. Okay. So what is the thalamus? As everyone says, it's an important relay system. It's like a hub for the brain right in the center. And there's two oval nuclei, as we can see in this diagram. They're paired in the middle and connected by this band in the center, the intrathalamic adhesion. Some other names for it also, the massa intermedia. And it's made up of discrete anatomical groups of nuclei. So the thalamus is part of the brain called a diencephalon, which from your embryology lectures is part of the forebrain and is a caudal part of the forebrain. So just here, other parts that make it up are the epithalamus, hypothalamus. So looking at the gross anatomy once more, this is looking at one of the hypothalami. And we can see there's a band running through it. This is one of the white matter bands. There's three in total. This is called the internal medullary lamina. It's very important because it makes our life a lot easier when we're trying to learn about it. It divides the thalamus into anterior here, lateral, you could also say posterior, and medial, okay? And here's the midline, which connects with the adhesion to the other side. Now you've got two other white matter bands. So on the superior surface, not seen on this image, there's a thin, very thin layer of white matter called the stratum zonale. And on the lateral surface, as we can see in the diagram here, there's another layer of white matter called the external medullary lamina. And at the back, there's two small outpouchings or structures. This is the medial geniculate body, as you'd expect on the medial side, and the lateral geniculate body. So just have a look at these names quickly, and then we'll cover them in a bit more detail what they exactly do. Okay, as we said, what is the purpose of the thalamus? Again, there's a multitude of purposes. This is looking at things very broadly. There's plenty of research ongoing, and there's plenty of answers still being sought. So it's a relay center for sensory information. Most sensory afferents pass through the thalamus, except olfaction, which is a sense of smell. And it's an important place for integration of motor function, receiving inputs from the basal ganglia, the cortical connections, the cerebellum, as well as deep from the brainstem. It's important for the limbic system, and it's very important for modulating consciousness. So again, just having a look at this picture in 3D, where the thalamus is, and so we can get a clearer picture of its relations to other structures. Okay, time for another question. So back onto your buzzers. Okay, nerves is at the top. Okay, what is medial to the thalamus? Nice, nice. You guys are very good. It is the third ventricle. So we'll be covering a bit more of the relations now in a second. Okay, Donna's gone to the top. Okay, Now, we're going to start by labeling everything. So let's start from the front, anterior, okay? So where my arrow is, can everyone see my arrow all right? Because it might make this next bit very difficult if you can't.
Yep, we can see it.
Okay, awesome. This is the thalamus on either side. This is us looking at the brain from the top. So this is just a superior aspect to things. This structure here is the intraventricular foramen of Monro, and it marks the anterior pole of the thalamus, right to the front, okay? And this vein that you can see coming here, this is the internal cerebral vein. And where it starts, this point, is again the anterior part of the thalamus. It's made of the thalamus striate and the septal vein, as well as these other sides, the superior striate, anterior terminal, choroidal. Could argue, I think this is a choroidal vein. Now we've covered anterior. Now let's cover posterior. This is a slice through the brain, slicing it in half from the front to back, sagittal section. So here we have a hypothalamus. Here we have the thalamus, okay? And on the back, we can see the pineal gland. And this is the corpora quadrigemina, which is the superior colliculus and inferior colliculus, which I think you may cover in later lectures. The other things also to bear in mind are the pineal gland and the habencula, which we'll have a look at now. So here we are. So now we're facing the thalamus from the back. You can see the cerebellum here. And here's the pons, the midbrain, pons, and medulla. This is the pineal gland. These are our colliculi, superior colliculi, inferior, habencula, and this whole structure is the thalamus. And as we talked about here, these are little bodies, lateral, medial, geniculate bodies. And this is the division, the pulvinar, okay, which we'll cover in a bit later. Now, medially, as a lot of you have already identified, are the lateral walls of the third ventricle. So once again, on this slice, a histological specimen, thalamus here, third ventricle here, and the lateral ventricle is on the top. And here, just to make it easier, more of a schematic diagram. So now moving on to things laterally. So this is an axial slice. So slicing it from, again, anterior to posterior. And here we have the thalamus once more. And here, laterally to it, is the posterior limb of the internal capsule. So the internal capsule is going from here to here. And the internal capsule separates the thalamus from the globus pallidus and the putamen. Sorry, that's the one on the outside is the putamen, one on the inside is the globus pallidus. Okay, now we're back to the image we saw to help us identify what was anterior. So now we're again looking from the top, from the superior aspect, back to the thalamus here. So on the top, so we've looked at it and we're going on top from the lateral ventricle. So the lateral ventricles sit on top of the thalamus, as you can appreciate from this slice here, okay? And the choroid plexus, the internal cerebral vein we talked about, thalamostriate vein, and there's a structure called the stria terminalis, which I don't think we can quite clearly see on this image. And then once more, the internal capsule, part of it just here, and the caudate nucleus are superior to the thalami. Okay? If you can see quite interestingly here on this picture, they've got striations marking the white matter bands which divide the thalamus. Now, what is below the thalamus? Thalamus is here. Ignore all of these pieces of text. Again, another part of the ventricular system, the aqueduct of Sylvius, is just below the thalamus. We've got the cerebral peduncle. And as you'd expect from the name, the hypothalamus, just underneath the thalamus. Okay, question time once more. So get your fingers on the buzzer and let's see where we are. Which nucleus receives prominent sensory input from the trigeminal tract? Nice. Oh, you guys could just skip this lecture. Oh, whoever Donna is, she's killing it. Big leader. Okay. So we're going to go through all of these nuclei in a bit more detail. Not every single nuclei, because depending on what system you use, you could have between 40 to around 100 nuclei. Okay, so this is where we were at the start. This is a picture of the thalamus overall. This is one of them. This is the thalamus on the right-hand side. Okay, as we talked about, that important white matter band, the internal medullary lamina, divides the thalamus into anterior, lateral, and medial aspects. Okay, and the important things to bear in mind is these groupings determine our classification of nuclei. So there's some nuclei in the anterior area, there's some medial nuclei, there's some lateral nuclei, and there's some intralaminar nuclei. And we don't have it on this picture, but there's just a sliver just on the outside here that forms a reticular nucleus of the thalamus. You can also divide the nuclei by their role. So some nuclei in the thalamus perform a relay function, as in they're like part of a circuit. So they connect defined inputs to outputs. Examples of this are the VPM, which is the ventral posteromedial nucleus, VPL, ventral posterolateral nucleus, which I think some of you are aware of already. Some of the nuclei are association nuclei. They receive inputs from cortical areas and project to association areas of the cortex. Again, the inputs and outputs here are a bit more vague, and the function is a bit more vague, as you'll see a bit later on. Then, even more non-specific are nuclei with broad and diffuse projections, such as the reticular and the intralaminar nuclei. The reticular nuclei has an important role in consciousness, hence, as you'd expect, it would have broad implications for cortical projections. Another way of dividing it is between first order and higher order. So first order receive direct, provide direct cortical output. Higher order provide thalamic output within the thalamus. So the first one where we are is anterior nuclei, just here. You can divide it in a number of ways. This is one way of dividing it: anterior ventral, medial, dorsal. Again, for I think medical school exams or just for that level, I think you just need to know that it's anterior nuclei. Again, this is not in no means exhaustive. There's numerous ways of dividing this. So if you were to put it on down to one group, it would be an association type of nuclei. Its primary function involves the limbic system and memory acquisition. And it's got an important connection with the mammillary bodies. So if you want to know the specifics, the lateral mammillary body connects to the ipsilateral, anteromedial, and anteroventral nuclei in the anterior nucleus and projects to all these areas. The cortex, the cingulate gyrus, an important structure in the limbic system, anterior limbic areas, the parahippocampal gyrus, and prefrontal and posterior areas of the cortex. And then the medial mammillary body projects bilaterally to the anterior dorsal area. It also receives inputs from the subiculum, which is part of the hippocampus. And as we've said, it's important for your emotional regulation, your state, your level of attention, and importantly, memory acquisition. Now we move on to this important structure I think you may have seen in some of your lectures, if you've got to that stage, which is the Pepez circuit. So the anterior thalamic nuclei, this is one that you, as we said, there's some that you need to know the specific name of. This is one of them, where it's got a connection from the mammillary body, as we said, through the mammillary thalamic tract. So it starts, let's imagine we start off here from the hippocampus. The information gets passed to the fornix all the way along, mammillary body, anterior thalamic tract. This passes along here to the cingulate cortex. It goes along and all the way back down to the hippocampus. And this circuit perpetuates. And this circuit has an important role in episodic memory. Now on to the next group of nuclei. So on this side of the division, the medial nuclei. So again, you can divide it in a number of ways. An important one here is a dorsal medial nucleus. And again, if however you choose to subdivide it, you can subdivide it further into anterior medial magnocellular, posterolateral parvocellular. So the fibers here, they can be one way in that there's fibers coming into the medial nucleus, or they can be reciprocal in that you get fibers coming in and going out. And like the anterior nucleus, it's an association nuclei, again with vague functions relating to association areas in the cortex. It's got important roles, as we saw with the anterior nucleus, for memory, processing of pain, planning, cognitive control, working memory, and decision making. And importantly, it's affected a number of conditions, including coarse-cause dementia, Alzheimer's, and Parkinson's. So as we talked about here, we could split it down further. I think this detail is quite extensive, but you could receive inputs from the amygdala, the pallidum, piriform cortex, and then you've got connections back and forth between the cingulate, as we saw earlier with the anterior cortex, anterior nucleus, the parietal cortex, and the insula. And as we said, memory, eye movements, sensory integration, and a wide range of functions with respect to executive function. So this one is more intrinsically linked with the prefrontal cortex. So now we move on to other nuclei. We're now in the midline nuclei. So this is a slice, the coronal slice, so that you can see from medial to lateral. This is superior, this is inferior, and anterior, posterior, we can't really tell in these kind of slices. So so this is the medial aspect. This is the dorsomedial nucleus that we were talking about. And even more medial to that, where the adhesion would be, there are some midline nuclei, okay? And again, I think the role is non-specific. The function is they may have some implications for conscious level, memory, and arousal. Nothing's been clearly ascertained. But there's all sorts of links here, as you can see, a broad range of functions. So they've got hypothalamic inputs from the hippocampus, from the periaqueductal gray. It's very important for pain, the spinothalamic tracts, the reticular formation, as we talked about, important links for consciousness, and it has effects to the hippocampus, amygdala, nucleus accumbens, and it's got connections back and forth with the cingulate. And anything with the cingulate, as we've seen, has roles for limbic function, hence emotion, and the orbitofrontal cortex. Now into the biggest group, okay? So we've covered the anterior group, we've covered the medial group, we've covered the midline structures here. Now the lateral group. As you can see, there's a number of nuclei here. So a way of thinking about it, a lot of people do, is a double-decker bus. So this is the top level, this is the bottom level, the dorsal level and the ventral level. The ventral level, I think, is more important because you can delineate their function a bit more specifically. And then you could argue whether these two are part of the lateral or they're their own group, the metathalamic nuclei, the medial geniculate body and the lateral geniculate body. Okay, this is now a different slice, again, to illustrate the double-decker analogy. So as we can see here, this is the one down at the bottom, the ventral aspect of the lateral nuclei, and this is the dorsal aspect. So let's start with the dorsal aspect because it's smaller, I guess. So again, these functions are not clearly identified, but from imaging studies and staining, as well as studies in animals with tracers, these have been seen to be the afferents, with the lateral dorsal, the pretectum, the superior colliculus, and broad range of links, the cingulate gyrus, parahippocampal gyrus, parietal cortex, and the subiculum. I think you're tending to see a fashion here, limbic areas, as well as areas involved in visual spatial function, as well as memory. Okay, and a similar story here for the lateral posterior nucleus. Now we'll have a look at the pulvinar. So this is a fairly large structure. Again, some people argue whether you can call this lateral or posterior. And again, we're calling it the pulvinar, but there's different forms of classification and you can break it down even further. So it receives input from the retina, visual association areas, the medial and lateral geniculate bodies, and inferior and superior colliculi, which we saw in the earlier diagrams. So these are involved in vision, auditory inputs, and a similar story here. Okay, so one can argue that the role is visual spatial processing, processing of perception, and processing of these in relation to cognition. So now onto the meat of the thalamic nuclei, the ventral nuclei. So the ventral anterior here, ventral lateral, and the ventral posterior. Okay, we'll cover each bit by bit. So the ventral anterior is a relay nuclei, as we talked about earlier. It's got predefined inputs and outputs. And the important point with the ventral anterior and the ventral lateral, these two at the front, is their motor relay areas. The ventral anterior area, it's been shown again, all of these are based on studies, that it's receiving input from the basal ganglia in the form of the GPI, and it also receives input from the substantia nigra. And it outputs mainly to the premotor cortex. It's also been shown to output to the primary motor cortex. And its role is primarily, as you can see from these, initiation and planning on movement, as the majority is output into the premotor cortex. Now, next onto the ventral lateral nucleus. Again, a motor nucleus. These two, remember, motor. And again, inputs are coming from the basal ganglia, which is an important structure that I think you'll have a lecture on in a couple of weeks with important roles for control and fine-tuning of motor function, and the cerebellum, which also has a similar role, and important roles in posture and balance. So again, outputs is the primary and premotor cortex, but I think the majority go to the primary in the ventral lateral nucleus. And as you can see, as you'd expect from where it's coming in and going out, coordination and modulation of motor movement. Okay, we're going to look at the ventral posterior nuclei. I think we're going to ignore this one for the purposes of this lecture. We're going to look at the VPL, the VPM. Okay, as I thought a lot of you already knew, the VPM is involved in the relay of facial sensation and taste. Okay, we can assume these from the inputs and outputs because these are relay nuclei with clear inputs and outputs. And unlike the ventral anterior and lateral nuclei, these are sensory thalamic nuclei. So you're getting your sensory inputs for the face from the trigeminal nucleus, and it travels up all the way here to the ventral posterior medial nucleus in the trigeminal thalamic tract. So it seems kind of logical here, the naming system. And then we've also got a tract, the nucleus tractus solitaris, and this travels in the central tegmental tract up here, and it delivers sensation of taste. And where does it go? To the somatosensory cortex. Now let's have a look at the ventral posterior lateral nucleus. Just a bit further posterior, and its inputs to the dorsal column, medial lemniscus pathway, and the spinothalamic tracts. And again, it goes to the somatosensory cortex through the internal capsule and the coronal radiata. And what is the purpose from this, as you can imagine? So all these tracts involve crude touch, light touch, proprioception, vibration, and pain. And hence, this is the purpose of what the VPL does. And finally, just on the structures at the back, the medial geniculate body and the lateral geniculate body. Okay, again, sensory relay nuclei. So the medial geniculate body is here, as you'd expect, more medial. Inputs are from the inferior colliculus, and there's some smaller inputs from the reticular formation, reticular nuclei, and other brainstem auditory nuclei. And the output is the auditory cortex. And as you can imagine, based on all this inputs and outputs, it's got a very important role for processing of auditory information. Now here, you've got the lateral geniculate body. So these ones sometimes are quite often confusing. This is processing auditory information, processing lateral light. So, visual information. So, just another mnemonic, L for lateral, L for light, something just to stick in the head. And the input coming here is from the optic tract, and the output is the occipital lobe. Both of these, if you've done your prior lectures on NeuroAnatomy of the optic tracts, auditory cortex, it must be ringing bells in your heads. I'll show you why. So both these diagrams, these are ones I'm sure you've drawn to death of the optic tracts. As you can see from the different pathways, they go here, the optic chiasm, they decussate, superior colliculus, and here, the lateral geniculate nucleus, which we've talked about, this important thalamic structure, and then back to the visual cortex, and then for the further visual processing. Now, if we look at the auditory one, so this is from the cochlea, so the cochlear nerve, cochlear nucleus, depending on the dorsal or ventral tracts, it either goes ipsilaterally or contralaterally to the superior olive in the medulla, and all the way up to the inferior colliculus, to the medial geniculate body, and then for further processing in the temporal lobe in the primary auditory cortex. Okay, now the white matter band that we've been talking about, that's been helping us divide the thalamus into medial, anterior, and lateral. They also have some nuclei within there. Again, this number of nuclei that I'm talking about is in no means exhaustive. As I said, depending on what atlas you use or what classification method, you can hit anywhere between 40 to 100 different nuclei. But here we're going to focus on two main ones, specifically one. The centromedian nucleus, just here in the center and the middle, centromedian. And then you've got smaller nuclei in the parafascicular nucleus. Its roles non-specific. Again, inputs from the spinothalamic tract, and reticular arousing areas. And efferent or non-specific areas, it goes quite broadly. So some people have hypothesized the role of the central median area is to regulate pain. But as we'll cover on later on, it's been used to treat a number of neurological conditions. So its exact function is still being investigated. And finally, a broader structure, the reticular nucleus. Again, just for orientation's sake, this is our Y-shaped white matter band, the internal medullary lamina, the midline nucleus, the medial nucleus, anterior nucleus, lateral nuclei with the dorsal nuclei on the top, the ventral nuclei on the bottom, pulvinar on the side, and then just on the outside, remember we talked about further white matter bands? There's the external medullary lamina here, and then we have the reticular nucleus. It's got a very important role with respect to consciousness, with conjunction with the reticular formation. It is the only nucleus which does not project to the cortex. This is very important to remember. And it projects back to the thalamus. And its role is modulating thalamic activity, and it's a very important role in consciousness and widespread afferents, as we can see, frontal, temporal, occipital cortices, and the midbrain. Okay, I'm going to give you a bit of a breather. I think that was a lot to take in, and we're going to spark our cognition once more with these cahoots. Okay, let's see whether we can take Donna off the pedestal. Okay, which artery primarily supplies the thalamus? So your options: the triangle, artery of Labe; anterior communicating as the diamond; the circle is the posterior cerebral; square is the callosal marginal. Okay, still maintaining the lead. Who is this? Wallace Copter is the highest climber. Good on him or her. Okay. So now we're at the home stretch for this lecture. So we're looking at the vascular supply. As many of you said correctly, the PCA is the primary supply, and it's got different branches, as we can see. So, I mean, we could go into the circle of Willis, but I think let's give that a miss for tonight. So this is the basilar artery. This is the combination of the anterior spinal, the vertebral arteries at the back, and then it splits off into the posterior cerebral, and this is the different branches. And then we go into the posterior communicating, and the paramedian artery here supplies the thalamus, and then we've got the infralateral supplying the thalamus just here, and then this is a branch of the posterior cerebral, the posterior communicating, and we've got a branch here, the tuberothalamic, and we've got another branch here, the lateral posterior. Again, we could go in a lot more detail. We could get a picture of the thalamus and work out which nuclei the artery is supplying exactly. But I think I say Tuesday afternoon. I think there's plenty of information being delivered already. Evening, sorry. Okay, so this is just an overview. It's not for you to learn or memorize, but it's something interesting. So, as I said, depending on which nuclei we believe the artery to supply, will depend on the focal neurology we'd expect. So cognitive and behavioral disturbances, left hemisphere lesions with this area, and this loss of time sense, the paramedian artery, again, consciousness. So as we talked about, we can see which nuclei affect consciousness, so we could allude to which ones may be affected. So again, aphasia, so again, speech. So again, it may be the broader areas which are affected, hemi-neglect, which may be due to visual spatial areas, and gaze abnormalities. And a very important one here is sensory motor deficits and Dejerine-Roussy syndrome, which we'll cover in a second. So I want to talk about a couple of clinical syndromes relevant to the thalamus. And again, it's in no means exhaustive, because I'm sure there's an exhaustive list of things that could preferentially affect the thalamus. So Dejerine-Roussy is normally a stroke affecting the thalamus. And it could be either an ischemic stroke, in that there's a lack of blood, or hemorrhagic stroke, in that there's a bleed. And although this is a classical description of it, lesions from MS, tumors, abscesses can cause a similar thing. And it's a pain syndrome. So initially following their stroke, the patient may have a period of numbness. Then a few weeks or a few months or a few days after, they get a burning and tingling sensation in that area that's affected. So like the cortex, there's a topographical organization, maybe the hand, it may be the leg that's affected. And depending on the person, the pain can either be mild or very severe. And it's intractable to most forms of treatment. And the majority of management is opioids or anticonvulsants. New treatments are being tried in the form of neuromodulation, in the form of DBS, spinal cord stimulation, transcranial magnetic stimulation, as well as transcranial direct current stimulation. Importantly, it causes both these things, so allodynia and dysesthesia. So allodynia is finding things painful, which you normally wouldn't find painful. Let me clarify whether that's what I meant. And dysesthesia is finding things... Sorry, guys. And dysesthesia is finding things painful, which you otherwise would not find painful. So based on this, we believe the ventral-posterolateral nucleus may be causative, as it involves the spinothalamic inputs. Another one which preferentially attacks the thalamus, which is an interesting condition, is fatal familial insomnia. It's a prion disease, which is an accumulation of an abnormal prion protein, which transmits and propagates. So what happens is you don't normally have problems with insomnia. This progressively increases to the point where you just don't sleep, and it leads to psychosis, hallucinations, eventually death. And based on PET studies, for some reason, it tends to preferentially alter metabolism in the thalamus, as we can see in the PET scan and the cartoon. And once you have it, it can last from between 7 to 36 months, with an average duration from onset to death of 18 months. It's very scary. Okay, so this lecture is from a neurosurgical perspective. So this is going to be very brief because it is a very complex topic. So as we talked about, we've covered these classification of the thalamic nuclei: medial, anterior, lateral, dorsal, ventral of the lateral area. But this is not the only way. There's numerous atlases or ways of locating things in the brain. So as you can see, there's these different classification forms, these different atlases. They use different abbreviations. Again, you can see some similar terms like we use ventral anterior, ventral lateral posterior. But some of them use very different ones, and it depends on the background. So clinicians tend to use ones with these kind of terms, the Hasler ones, and physiologists and anatomists tend to use the ones that we've used. So again, just to illustrate to you the complexity of thalamic nuclei. So the ones we use are more kind of fitting with these kind of models. As you can see, lateral posterior, pulvinar, medial geniculate, lateral geniculate nucleus, reticular. But as you can see, one can classify it in a number of ways. So the methods for classifying it based on animal studies, so immunostaining, depending on different neuronal populations, as well as now MRI studies where they looked at connectivity with different tracts coming into the thalamus and exiting the thalamus. But of course, the difficulty with that is certain nuclei are very broad and they've got a lot of overlapping function. So when things have overlapping function, it's very hard to distinguish between different groups. So again, this is, I think, you may feel looking at those maps, oh, I've learned something, or it might be redundant. But as in this broad form of classification is very useful, as we covered earlier. So anterior, lateral, posterior, medial. As you've seen with the anterior, you could split it into a number of nuclei. With the lateral, you could split it into these. These ones are very important. And of course, you could subdivide these, but I think these groups will hold. Ventral anterior, ventral lateral, which are the motor ones. Ventral medial, ventral posterior. And again, split into the three. And then, of course, your pulvinar, your lateral and medial geniculate bodies. And here are further classifications of the following. So what is the relevance of these? So you can target the thalamus, you can do a thalamotomy, you can burn a certain nucleus, you can use DBS, you can put an electrode in and stimulate that part of the nucleus to cause a similar effect. And now it's starting to see new treatments in the form of highly focused ultrasound, which is this on the bottom, where he goes into an MRI machine and using special ultrasound coils or collimators, you're able to target specific areas of the thalamus by causing initially irreversible temperature changes to cause an effect, and then permanent temperature changes to burn off that area without any surgery. It's relatively non-invasive. So primarily the areas targeted in the past or even currently. So when you have essential tremor or even tremor associated with Parkinsonian disorders, the areas that are targeted are the VIM. You guys might be confused. What is the VIM? We haven't covered this. And again, it relates to the fact about these atlases and the different nomenclature. So the VIM would most be fitting in the ventral lateral nucleus, which we talked about, which is one of the motor nuclei. But again, the exact location and where it fits on the map, one would have to correlate between the different atlases. And again, the VOP is a similar story. And one that's being explored right now is the central median nucleus. As we talked about, it's got an important role for the emotional coloring of pain. So of course it would have a relevance for treating pain syndromes, but they're also being investigated for treating Tourette's and epilepsy using similar modalities as above. Okay, thank you for listening. We're going to do a final Kahoot to determine our winner. I think there's plenty to be had. There's a few more questions. And please do reveal yourself at the end if you've won a prize. Okay, you guys ready? Fingers on the buzzers. These questions are 10 seconds, okay? What is the name of the band that divides the thalamus into anterior, lateral, and medial parts? Triangle, massa intermedia. Diamond, internal medullary lamina. Square, reticular division. Circle, thalamic adhesion. Nice, nice. You guys are paying attention. It's the internal medullary lamina. Okay, okay. Donna's extending her lead. Okay, next question, 10 seconds. What does the Pepez circuit involve? Visual memory, semantic memory, auditory memory, episodic memory. Nice, nice. Episodic memory, as we talked about, the hippocampus, the singular gyrus, the mammillary bodies. Okay, wow. I think Donna's cheating or something here. Okay, which nuclei does not project to the cortex? Anterior with a triangle, reticular with a diamond, intralaminar with a circle, dorsal-medial with a square. Nice, nice work. You guys have really been paying attention. I'm impressed. Or you either probably knew this before coming. Oh my gosh, someone stop Donna. 2 more questions. Which tract provides input to the VPL? Spinocerebellar, vestibulospinal, corticospinal, spinothalamic. I'm sure they all do to a small degree, but which is the most important one? Nice, good job, guys. Okay, it's getting close. It's getting close. Which nucleus is this? Oh God. Okay, here we are. Sorry about the delay. Okay, that's the one. So which of these is it? Sorry, I should have given you a bit more time. I think it's to throw off Donna. But nice job, whoever got lateral dorsal. Damn. Okay. Final question. What term best describes pain due to a stimulus that does not normally provoke pain? Okay, nice job. If I confused you, apologies. I think I may have drank. So pain due to a stimulus that does not normally provoke pain is allodynia. Sorry, dysesthesia I think is worsening pain. Let me just Google this for you guys just to get some clarity. It's very confusing. I've probably confused you guys. Dysesthesia, abnormal burning. Dysesthesia. Hyperesthesia, excessive physical sensitivity. Allodynia, stimulus that does not normally elicit pain. Okay. Let's see where we are. Okay, nice job, Anchor. I think we should do 3 prizes. Good effort, because there's so many people here. You. I think we can guess who's at the top. Donna, nice work, guys. Okay, so if you guys are more interested, as I alluded to in the lecture, there's a number of ways of classifying it. You can have a look at these articles, and they might stimulate your curiosity. And if you'd be kind enough, here's a QR code for some feedback. I'd really appreciate it.
Thank you so much, Rhannon, for your talk this evening. I'm sure everyone's learned a great deal. If you could all be so kind and fill out the feedback, because you can see a lot of effort was put into the talk this evening. And if anyone has any questions, just unmute your microphone or you can raise a hand. We realize the chat box isn't working, so apologies for that.
Yeah, if you guys have any questions, feel free to email or feel free to ask now. I'll try my best to answer it. If I won't, I'll try and get back to you somehow. Does anyone have any questions at all?
Ryan, is it okay if you stick the QR code up? Because I don't know if everyone's managed to get it, perhaps. Does anyone have any questions?
I guess that's good news. There's no questions, or bad news. Either one of the two. I guess everyone just knew it, or it's just stunned silence. I think just let's try and identify the winners, if they'd be willing to do so. So Anchor, you, and Donna, if you could come on video or on chat and then tell us who you are, so we can give you some prizes. Organize for some prizes.
Hi, I'm Yu. Can you see me? Yep, we can see you. I know. My name is Faria. Nice to meet you guys. Nice to meet you. I think you're on mute.
Hear you. We can't hear you. We're on mute.
Sorry. If you just pass your details on to the organizers, then we can try and organize for some kind of prizes on them.
Oh, are there really going to be prizes?
Yeah, there is. I'm not lying. Why would I?
Okay, fine.
I'd form to lie.
Great. Yeah, fine. Sure. Should I just send my email then, or?
Yeah, send an email to the organizers, and I'll try and sort something out. And just need to find Anchor and Donna now. The elusive Donna.
Hi.
Hi, I'm
It's
Anka.
Donna. Hello.
Yeah. Hello. Hi. We
Hi.
can
Hi.
hear you. Hi, Donna. Or is it Anchor?
Hi.
Would this just be to the Imperial Neuroscience Society
Yeah,
email?
yeah, or the Barts one. I think whoever's organizing it. Just send. I think if you guys are shy, just send an email. Just saying who you are. I mean, if you're not Donna, please say
Could you
Donna.
send it to lha16@ic.ac.uk? Purely because that way I won't miss it.
Okay, sure. Thanks.
Thank you.
Could you please say the email again? Sorry.
So L for Lima, H for Harry, A for Apple, 16 at IC neuroscience.ac.uk.
Thank you.
Yeah, thanks for listening, guys.